Knock, knock.
Come in.
Hey, Ronnie. Good afternoon. My name is Joan. I'm going to be your student nurse for the day. I am going to do your full head to toe exam. And let me wash my hands real quick and close the curtain for privacy. And so could you give me your hand, please? Could you verify your name and date of birth?
Ronald Patrick, May 1994.
All right, thank you so much. And this video is going to be recorded. Is that okay with you?
Okay.
All right, so I am going to do your full head to toe exam, and I am going to be inspecting several parts on your body. I am also going to be palpating, which is like touching to feel for any tenderness, any masses, and let me know where you have pain, where you feel pain as I go on with the exam. And if you have any questions, please feel free to ask me, okay? And so I am, for the general survey, the patient, the stated age matches the patient appearance, and he appears well groomed, and he's able to follow directions. I mean, I asked for his hand, and he gave it to me. So, Ronnie, could you tell me where you are, please?
11:05 in Circle.
All right, and could you tell me the time
5 p.m.
and the date?
2nd April.
All right, so my patient is alert and oriented to date, time, and place. So, excuse me, I am going to begin with the skin, and for the skin, I am inspecting for any lacerations, any skin rashes, any skin breakdown. But before I start, do you have any rashes?
No.
Any skin breakdown?
No.
All right. So I can see his arms, I can see his neck, his face, and he would be in a journey, but for purposes of this video, we are going to keep his clothes on. And upon inspection, the skin color matches ethnicity. He doesn't have any lacerations, no rashes. So next, I am going to move on to the hair. And for the hair, I am inspecting for distribution and the color, texture, and upon inspection, his hair is evenly distributed, and it's black. So that's it for the hair. So next, I'm going to move on to the head. And before we start, do you have any headaches?
No.
All right, so for the head, I am going to begin by inspecting for the shape and size of the head. And upon inspection, the head is normocephalic. And I am also inspecting for any lesions, and he doesn't have any lesions. So next, I'm going to inspect the facial structures for symmetry. Could you raise your eyebrows? Could you close your eyes? Could you puff your cheeks out? Could you stick your tongue out? Or cranial nerve 7 is intact. Could you show me your teeth? Okay. All right. So the facial structures, the facial structures are symmetrical. So next, I am going to palpate for any tenderness or bumps. And do you have any pain?
No.
Okay. All right. So patient denies having any pain, and there is no tenderness or bumps in the head. And I am going to palpate. I am going to assess for cranial nerve 5. So I am going to have two objects. One is going to be sharp and the other is going to be soft. You're going to have your eyes closed and tell me what you feel, okay?
Okay.
All right.
Sharp. Soft. Soft. Sharp. Soft. Sharp.
All right. So cranial nerve 5 is intact. I am going to palpate the TMJ for any crepitus. Do you have any pain?
No.
All right. So the temporal, there is no crepitus in the temporomandibular joint. So next, and there is no bumps. So next, I am going to move on to the eyes. And before we get started, do you have any recent change in vision?
No.
All right. And I am going to begin by inspecting the eye structures for symmetry. And I am also going to inspect like the eyebrows, the eyelids, the eyelashes for symmetry. I'm also going to inspect the sclera and the conjunctiva for any crusting, any drainage. Could you open your eyes, please? All right. Could you? Okay. And the eye structures are symmetrical, and the sclera is white and moist, and the conjunctiva is pink and moist. So next I am going to assess the pupils, the pupillary reflexes. You're going to tell me if you see my arm with my hand with your eyes, okay? Do you still see my hand? All right, and this side too.
Yes.
Okay, so next I'm going to assess the 6 cardinal fields, and I am assessing for movements and convergence. And for this I'll be assessing cranial nerve 3, 4, and 6. So could you look at this pen and look at me, and could you look at the pen? All right, follow the pen with your eyes, and okay, and okay. All right, so there is pallor. The pupils are equal, round, and reactive to light. He doesn't have any nystagmus, and there is no convergence. Oh, so yeah, there is convergence, and cranial nerves 3, 4, and 6 are intact. So next I am going to move on to the nose and the sinus area. Any change in smell?
No.
All right, so for the nose, I am going to begin by inspecting for color. I am also going to inspect for any scars and for symmetry and discharge. And upon inspection, he doesn't have any discharge. The nose is midline and the skin color matches ethnicity. He doesn't have any lesions or scars. So next I am going to I am going to assess for patency in the nose. So you are going to occlude with your eyes closed, and could you blow out for me, please? And this side. All right, so there is patency in both nares. So next I am going to assess cranial nerve 1. I am going to have 2 different kinds of smells, and you are going to tell me what you smell, okay?
Okay.
With your eyes closed, please, okay? All right, could you occlude one nostril? What's that?
Coffee.
All right, and
Vanilla.
all right, so cranial nerve 1 is intact, and so next I am going to palpate the external structure, and I am also going to palpate the sinus area. That's the frontal and the maxillary sinuses. And do you have any pain?
No.
And I'll palpate the frontal sinus area, and the maxillary sinus area. All right, so there is no tenderness, and patient denies having any pain in the sinus area. So next I am going to move on to the mouth and thorax. And before we get started, are you coughing?
No.
Any choking?
No.
Any trouble, any difficulty swallowing?
No.
All right, so I am going to begin by inspecting the lips for any fissures, and his lips he doesn't have any fissures, and they're not cracked, they're not dry. So I am also going to inspect the oral mucosa, the gums, and the tongue, and the flow of the mouth. Could you smile? Okay, and could you open your mouth and stick your tongue out? Could you pick it up? No, pick it. Okay. And could you say ah?
Ah.
Wait a minute. Okay, open your mouth and say ah.
Ah.
Okay. So there is equal rise and fall of the uvula and the palate, and so that's cranial nerve 12, and like I said in the beginning, he doesn't have any fissures on his lips. His gingiva is pink, and the tongue is midline, and there is no discoloring down by the frenulum, and cranial nerve 9 and 10 is intact, as he was able to say ah, and he moved his tongue. So next I am going to move on to the ears, but before I start, any change in hearing?
No.
All right. So I am going to begin by inspecting the external ear structures. I'm going to inspect the tragus, the auricle, and the lobule. I'm going to inspect for the skin color, any scars, and for symmetry. And upon inspection, the external structures are the ears are symmetrical, and the skin color matches ethnicity, and he doesn't have any scars on the ears. So next I am going to palpate the auricles and the tragus for any tenderness. Okay. Do you have any pain?
No.
All right. So there is no tenderness, and the patient denies having any pain. I am also going to do the whisper test, and this is to assess for cranial nerve 8. So I am going to say a 2-syllable word, and you are going to tell me what you hear, okay? So I'll stand about 2 feet, 1.5 to 2 feet away from him. And
Popcorn.
all right, and on to this side.
Red socks.
Okay, so cranial nerve 8 is intact. So next I am going to move on to the neck, and before we get started, any pain in the neck area?
No.
Any changes in your voice?
No.
All right, so I am going to begin by inspecting the neck for skin color, any lesions, any enlarged thyroids, any lymph nodes, and upon inspection, the skin color matches ethnicity. He doesn't have any enlarged thyroids. He doesn't have any lymph nodes. And could you please stand to your left? And he doesn't have any jugular venous distensions. So next I am going to palpate the neck for any tenderness or masses, any nodules, and you let me know if you have any pain, okay?
Okay.
Okay. Any pain?
No.
Okay. All right. So there is no tenderness, there is no masses, and patient just denied having any pain, and no nodules. So next I am going to assess for range of motion in the neck area, and we are going to begin with flexion and extension. Could you bend your ear to touch your shoulder, and do it on this side too? We are going to do rotation. Could you rotate your neck around, move it up and down? So there is full range of motion in the neck area. So next I'm going to test for the strength in the neck area. Could you push out against me, and this side, and here, and here. So the strength is 5 out of 5, and I am also, and upon assessment, cranial nerve 11 is intact, and that's that's the lower trapezius. So cranial nerve 11 is intact. So next I am going to move on to the anterior thorax, and for the anterior thorax I am going to start with the cardiovascular exam, and for this exam he would be in a hospital journey, so his skin would be out, but he's keeping his clothes on, and I am going to start by inspecting the precordium for any skin color changes, any lesions, any heaves, any thrills, any pulsations, any use of accessory muscles or tripoding. And upon inspection, there is no use of accessory muscle. My patient doesn't look like he's any respiratory distress, and he doesn't have any heaves, no thrills, no heaves, and the skin color matches ethnicity. So next I am going to palpate the precordium for any tenderness or any masses. And oh, did I remember to ask you if do you have any chest pain?
No.
Any shortness of breath?
No.
All right, so I am going to palpate for any tenderness or masses. I'm going to palpate the precordium area and the clavicles and the sternum and the ribs. Okay, let me know if you have any pain. Okay. All right. Any pain?
No.
All right. Okay, so there is no mass, there is no tenderness or masses. I'm going to palpate for the PMI, which is on the mid clavicular line. Okay, and the PMI is 74 because I did that for 30. It's supposed to be 1 minute. So next I'm going to auscultate for the 5 heart sounds, and I would be doing this. I would be doing it in 4 different cycles, but for purposes of time, I am just going to do it once, and I am going to listen for the rate and rhythm in the 5 heart sounds, and I will be using the diaphragm side of my stethoscope. So I start with the aortic area, which is on the 2nd intercostal space on the right sternal border. Again, this would be right on the skin. All right, and then I move on to the pulmonic area, which is on the 2nd intercostal space on the left sternal border. And then I move on to the abs point, which is on the 3rd intercostal space on the left sternal border. And then the tricuspid, which is on the left sternal border, 4th intercostal space. And then finally the mitral area, which is in the mid clavicular line on the 5th intercostal space. Wow. All right, and then I'm going to auscultate for striders in the trachea. Okay, so there is a regular rate and rhythm in all the 5 heart sounds, and he doesn't have any striders. So next I am going to auscultate the 8 lung sounds, and the first 2 are the bronchovascular and the other 6 are the vascular sounds. All right, so the lung sounds are clear, the bronchovascular sounds are clear, and the vascular sounds are clear. So next I am going to move on to the abdomen. And for this exam, do you want to use the restroom before we get started?
No.
All right. And do you have any pain?
No.
All right. So for the abdomen, I am going to begin by inspecting for skin color, any lesions, any scars, any striae, and any hair distribution, any pulsations, and for symmetry. And upon, could you put your hands down, please? And upon inspection, the skin color matches ethnicity. He doesn't have any striae, no scars, and no pulsations. So next I am going to auscultate. I am going to listen for the bowel sounds in all the 4 quadrants, and I would start with the right lower quadrant, and I'm doing this in an S pattern. I am using the diaphragm side of my stethoscope. Okay. And then move, oh, so this is the right lower quadrant. Okay. And then move on to the right upper quadrant. Then move on to the left upper quadrant. And then finally the left lower quadrant. So he has active bowel sounds. So next I'm going to palpate the abdomen for any tenderness, or you let me know if you have any pain, okay? And I'm using one arm, one hand. Do you have any pain? Okay. All right. So upon palpation, he doesn't have any tenderness, no masses, and he doesn't have any pain, as he stated. So next I'm going to move on to the musculoskeletal and the peripheral vascular, and I am going to start with the upper extremity. So do you have any pain?
No.
In your upper body?
No.
All right, so for this I am going to start by inspecting for any I am going to inspect for the skin color, any I'm going to inspect the upper extremity joints for symmetry, and the skin color matches ethnicity. He doesn't have any scars, no lesions, and his upper extremity joints are symmetrical. So next, his upper extremity joints, I mean the hands, the wrists, the shoulders. So next I am going to palpate the upper extremity joints for tenderness, temperature, and any masses. Do you have any pain? Okay. So the skin feels warm, dry and intact, and there is no tenderness. So next I am going to, and he doesn't have any crepitus. So next I am going to test for range of motion in the upper extremity joints. We are going to start with adduction and abduction. Could you raise your hands up, and then bring them back down? And then we are also going to do flexion and extension. Could you flex your elbows and extend them out? And so there is full range of motion in the upper extremities. So you're going to do I'm going to assess for strength. Can you do that again and push against me? Push up against me. Could you raise your hands up again and push up against me? Okay, push down against me. All right. So there's full. The strength is 5 out of 5 in the upper extremities, and there's full range of motion. I am going to assess the capillary refills. Can you give me your hands, please? Your tongue, please. Could you do this? Okay. So capillary refills is less than 2 seconds. I am going to palpate the radial and the ulnar pulse. Could you put your hand? Okay, and then the ulnar pulse, which is by the pinky side. This way. All right. So the pulses are +2, and the ulnar and the radial pulses are +2. Oh, maybe we forgot to do the pronator drift. Could you stretch your hands out with your eyes closed and Okay. All right. There's full range of motion, and he could do it. All right. So we are going to move on to the neural coordination for the upper extremities, and we are going to assess. We are going to assess your finger, the finger to nose rapid movement. So you're going to touch your nose and touch my finger, okay? Okay. Okay. All right. So next we are going to assess the rapid finger to thumb movement. You're going to move. Make sure all your fingers touch your thumb. All right. So there is intact and there is neural coordination as patient is able to follow directions. So next I'm going to move on to the musculoskeletal and peripheral vascular for the lower extremities. And for this, do you have any joint pain in your lower extremities?
No.
Any pain, any numbness or tingling?
No.
All right, so I am going to begin by inspecting for any for skin color, any lesions, any scars, and symmetry, and upon inspection, there is symmetry in the lower extremity joints. The skin color matches ethnicity, and he doesn't have any lesions or scars. So, and for the lower extremity joints, that includes the hips, the knees, the ankles, and the feet. And so next I am going to palpate the lower extremity joints for any. I am going to palpate the lower extremity joints for any tenderness and for the temperature or masses. All right, so the skin feels dry, warm, and intact, and he doesn't have any masses, no tenderness. I am also going to inspect for palpate for edema in the feet and the legs. So there is no edema in the lower extremity. So next I am going to I forgot to palpate the posterior tibial and the pedialis, the dorsalis pedis pauses. So can you? All right, and those are right here, and yeah. All right. So the pulses, the posterior, the pulses are +2. And so next I am going to assess for range of motion in the lower extremities. And we are going to begin with flexion and extension. No, could you stretch your legs out and back in? And we are going to do the plantar and dorsiflex. Could you plant your feet to the ground and up, please? So I'm going to assess for the strength. Could you stretch your legs out? Could you push up against me? And here and down. So can you plant your feet to the ground again and push against me, and then up. All right. So there's full range of motion in the lower extremity joints, and the strength is 5 out of 5. So I am then going to move on to the neural coordination for the lower extremity joints. For the lower extremity, and for this we are going to do the heel to shin test. Could you move your leg from your heel to your shin and do it on the other side? All right. So he's able to do the heel to shin test. So next I am going to move on to the exterior thorax, the respiratory. Could you please stand and face this side? All right. sorry. So for this, I'm going to inspect for skin color, any lesions, any scars, any accessory muscle use, shoulder symmetry, and any retractions. And upon inspection, the skin color matches ethnicity. Again, this would be right on the skin. He's not using any accessory muscle, and there is no he doesn't have any lesions, no scars, and no deformities. So I am going to inspect the shape of the anterior thorax, and okay, no, sorry, what to do side. All right. So the anterior thorax is the ratio is 1 to 2. So next I'm going to palpate for any tenderness, any masses, and I'll do the thoracic spine and the cervical spine, the scapula, and the ribs. Do you have any pain?
No.
Okay. Any pain?
No.
Okay. All right. So there is no tenderness or mass or the ribs. There is no tenderness in the exterior thorax. So next I am going to auscultate and listen for the 10 lung sounds, and the first 4 are the bronchovascular and the other 6 are the vascular sounds. I am using the diaphragm side of my stethoscope, and I am avoiding the scapula and any bony areas. Okay. Okay. Could you take a deep breath, please? Okay. Okay. Deep breath. All right. So the bronchovascular and the vascular sounds are clear. So next we're going to move on to the spine. Could you please stand up? And so for the spine, I am going to begin by inspecting the structure of the spine, and for any deformities, could you bend forward, please? And with my patient in this position, there are no deformities in the spine, and he doesn't have any curves in the spine. So next I am going to palpate for any tenderness in the cervical, from the cervical to the lumbar spine area. Do you have any pain?
No.
All right. So there is no tenderness in the spine. Could you get up, please? So next I am going to assess for range of motion, and we are going to begin with flexion and extension. You are going to bend forward and then back up, and we are going to do the lateral bending. You're going to bend side to side. Okay, and we're going to do rotation. You are going to rotate side to side. So there is full range of motion in the spine, and for the spine we do not test for the strength. So finally we are going to do the neural coordination for the we're going to move to the neural coordination. So I'm going to begin by assessing the Romberg test. Could you close your eyes and put your arms straight? All right, and so we're going to do the tandem walking. I am observing for gait. So we're going to do the heel to toe walk. You are going to walk your heel to your toe. Okay. All right. So, okay, you're good. So the patient is able to tandem walk, and there is smooth gait. and he was also he did not fall or look like he wasn't balancing during the lumbar test. Thank you.